Madam Chair, apologies for the delay. We're live on YouTube.
Okay, thank you very much. Good morning, everyone. This is the Public Employee Benefit Program meeting on November 21st, 2024 at 9 a.m. The exact time is 9:07. We're conducting this meeting in Carson City. I'd like to call the meeting to order, and staff, would you please take roll?
Good morning, everyone. Chair Grimmer,
Present.
Michelle Kelly,
Here.
Jim Barnes,
Here.
Jennifer McClendon,
Here.
Janelle Woodward,
Here.
Betsy Strasberg,
Here.
Stacy Weeks.
Here.
Thank you. We do have a quorum. Please remember to state and spell your name for our reporter. Thank you.
Okay, we'll now move on to agenda item number 2, public comment. Public comment will be taken during this agenda item. No action may be taken on any matter raised under this item unless the matter is included on a future agenda as an item on which action may be taken. Public comments to the board will be taken under advisement, but will not be answered during the meeting. Go ahead.
Okay, one moment, I'll flip the camera over. There you go.
For me? Go ahead.
Good morning, Chair and members of the board. For the record, my name is Tess Opferman. I am here on behalf of the AFSCME retirees. I know I come to most meetings and sort of say the same talking points. So I am repeating some of those talking points about the health reimbursement arrangement. I did want to update you. We sent out a survey to our members earlier this fall and have received quite a bit of feedback about the amount our retirees are paying for their health care and who is using their HRA accounts. We're still kind of collecting that data and creating one pager. So as soon as we get that done, I'll give that to the board and to staff. But in the meantime, I just wanted to give you some high level takeaways that we've gotten back so far. So the first piece being roughly 50% of our respondents are showing that they just clearly don't even understand their HRA benefit. We asked them how much they receive for their HRA, how much they receive from PEB, how much they receive from via benefits. People either couldn't give that number or gave numbers that are just outlet, $3,000, $5,000, numbers that are just not even possible for the amount that HRA can be. So I just want to flag that because I know that some of the concerns that I brought to this board are that our retirees aren't using that account because they don't know how or don't know what it is, and so I just think across the board we need to be really doing some more work to make sure retirees understand how to use that, what the account is, what it's for, because if we have 50% of people coming back just giving numbers that aren't possible, that really shows a flaw to us. And then I'll also just say, so of the 50% that do understand their benefit and say they use it, they are very clear that it is not nearly enough to cover their healthcare costs. Their healthcare costs are in the range of $600 a month, $900 a month, $1,000 a month. We have respondents, they gave there was a portion where they could write their own experiences, and one person said it perfectly. She said, my healthcare benefits go up, or my healthcare costs go up every year. My HRA has never gone up, or at least not since 2015. So I know I just continue to bring that story to the board. I wanted to, like I said, when we get the when we pull our one pager together and get all the data, I'll give that to all of you because I think it's really useful. So with that, I appreciate your time.
Thank you. Okay, next public comment in Carson. Okay, seeing no further public comment in Carson, do we have any public comment online?
Yes, we do, Madam Chair. We have about 11 in the lobby right now.
Okay.
I'll get the public comment slide up. As a reminder, joining the Zoom meeting as an attendee is for making public comment only. If you do not wish to make a public comment, please leave the meeting so you're not accidentally called upon, and please watch it via the YouTube live stream on the PEB YouTube channel. The link for the live stream is also located on the agenda on the PEB website. For those who have joined For public comment, your name or last four digits of your phone number will be announced. You will be advised you have been unmuted. Please slowly state and spell your name for the record, and then proceed with your comments. Debbie Ortega,
Hi,
Please.
good morning. Can you hear me?
as we can, please slowly spell and state your name for the record.
Okay, my name is Debbie Arteaga. That's DEBBIEARTEAGA. And I'm the chair of the Faculty Senate at UNLV. I want to speak against the elimination of the HMO. I'll begin with continuity of care. Many doctors on the HMO do not accept PPO insurance. Several colleagues have providers such as primary care providers, PCPs, specialists, and pediatricians for their children that they or their children have seen for years. Their primary care provider has a full picture of their health as it is a coordinated care model. Their PCP sends them to specialists if needed and receives the results of all visits and tests. PCPs and specialists work together seamlessly in providing health care for their patients. New providers will require the transfer of all health records and will disrupt the provider-patient relationship. For those with chronic conditions, finding a new specialist will be difficult. I'll give you the example of a patient who is getting chemotherapy 3 times a week. They will not be able to find another oncologist until they receive their new insurance card on July 1st, 2025, as providers require this information before they will schedule appointments. It can take months to find a new provider as a new patient, and in the interim, they will not receive life-saving chemotherapy. Colleagues have many other chronic healthcare conditions that need continuity of care. Many doctors on campus have also contacted me. They mentioned that the Southern Nevada medical community will be thrust into chaos because many PPO providers are not accepting new patients. There will be a larger number of patients requiring care from the same pool of doctors and specialists. According to U.S. News and World Reports, Nevada already ranks as 50th for access to healthcare and 49th in insurance coverage. Doctors argue that there will be serious repercussions to healthcare. For example, they are concerned that medical conditions will be diagnosed too late to treat successfully, as patients will forego preventative care. Now I'll quickly address hiring and retaining employees. UNLV has always prided itself on the quality of our employees. Some colleagues have told me that they will have to leave UNLV if the HMO is eliminated. In some searches, the committees were not able to hire their top choices because these candidates balked at our benefits as they exist now. Eliminating the HMO option will exacerbate this problem. Thank you for your time.
Thank you. David Kelsey, please slowly state and spell your name for the record if you wish to make public comment. David, I see your mic is unmuted. David, we'll try coming back to you, okay? Caller with the last four digits, 6837. Please press *6 to unmute. And please state and spell your name for the record.
Hello, this is Kent Irvin. There's a very large echo on the line. Can you hear me?
Yes, we can.
Kent Irvin, KENTERVIN, Nevada Faculty Alliance. I'm trying to speak over the echo. Good morning, Chair Grimmer, Vice Chair Kelly, board members, Executive Officer Glover. We have seen the written comments from many participants opposing the elimination of the HMO EPO plan option. They are legitimately frightened that a plan they depend on for control of unexpected costs and for essential providers will be taken away. We appreciate the hard work of the PEB staff and board members on behalf of participants, and that fiscal decisions can be difficult. Please trust members to know their needs. They may be uncertain about some plan option details, which is an education issue, but they know what they are paying, they know how they're being billed, and what their risk tolerance is. Listen to and respect their concerns. The NFA opposes the elimination of the HMO EPO plan. The results of the HMO RFP need to be taken into account, but a plan with a cost structure similar to the HMO and including the unique providers in the Southern HMO network is essential. The low deductible plan should be the true middle plan with a modest deductible, co-pays, and co-insurance. Giving it a pseudo HMO payment structure will raise the premiums and is not a good solution. The HMO EPO option should be the zero deductible plan with co-pays and no co-insurance. The 20% to 30% of participants on the HMO are willing to pay higher monthly premiums in exchange for certainty in out-of-pocket costs and access to their current providers, as Chair Arteaga mentioned. For a family, the current FY 2025 premiums for the HMO EPO is actually $38 per month lower than it was in FY 2021, so their costs have not risen like the other options. The low deductible plan should be positioned between the HMO and the lower cost high deductible plan. Please refer to my written statement submitted with our faculty survey results and for additional policy reasons to retain the three plan options. There is substantial demand for the HMO, and lower out-of-pocket costs are rated more important than lower monthly premiums. Finally, making a major plan design change in January, short before rate setting in March, during the legislative session is not a wise strategy. The strategic planning session recommended delaying plan design changes until the FY 2027 plan year. That makes sense, and it applies especially to a major change like restructuring the plan option. PEB members are demanding that the three plan options, including the HMO, be retained. Thank you.
Thank you, Mr. Irvin. For the call with the last four digits, 0482, please press *6 to unmute, and please slowly state and spell your name for the record.
Hi, my name is Chantal Marshall, SHANTAL MARSHALL. Hopefully you can hear me okay.
Yes, we can.
Perfect. So I am both a faculty member at Nevada State as well as the Vice President of the Nevada Faculty Alliance, and I wanted to call to echo my colleagues' comments that we should really not eliminate the HMO and the EPO because there are many people who rely on it and who have specifically chosen it because of the lower and predictable copays for their health visits. I am actually one of those people, and I am very much against eliminating this particular insurance plan. I've been on it for, this is my 12th year now, and I've consistently looked across all of the options and always chosen this one because I just like to know how much I'm going to pay upfront without having to think about it whenever I make my medical decisions. Currently, I am pregnant, and this has actually been a really important part of that journey of having this particular health insurance. And I think if I had a different one, thinking about all of the costs would add a lot of stress to what is already a very stressful, journey. So I just wanted to echo that and to echo Ken's comments as well, that many of our members in NFA have been very upset about the possibility of getting rid of this particular insurance plan without a viable option to replace it that basically has similar coverage and similar options. So thank you so much.
Thank you. Well, the caller with the last four digits, 1656. Please press *6 to unmute, and please slowly state and spell your name for the record. Call it the last four, 1656. Caller with the last four digits, 3870. Please press *6 to unmute, and please slowly state and spell your name for the record.
Hi, can you hear me?
Yes, we can.
Okay. Hi, my name is Raquel Rodriguez, RACUEL RODRIGUEZ. I am currently a classified employee with the University of Nevada, Las Vegas. I am flabbergasted at the attempt at poisoning away employees from the HMO by saying that they are hidden costs we do not realize we are paying. I say to you, we know exactly what we are paying for. We are paying for peace of mind, and we are willing to pay a premium for this. I have been on an HMO plan most of my adult working life. Even before becoming a classified employee for the state, HMOs have always worked well for me. Now, we all know how difficult it is to find good doctors in Nevada. It took me 6 years before I finally found a doctor that actually listened to my health concern, that didn't abruptly leave the state after just 1 or 2 appointments. I have been with my current doctor's office now for 7, almost 8 years, and the thought of looking for another primary care physician and replacing the specialist I see if we lose the HMO network is both frightening and frankly infuriating. Now, my sister is on a CDHP through her husband. I can't tell you over the years how many times she has gotten the mail and been starting cussing up a storm because yet another unexpected medical bill came in and now she has to figure out how to pay for it. I have never experienced that on the HMO. Again, I am willing to pay a premium for peace of mind to not have to deal with that kind of nonsense. I already am dealing with enough medical issues. I don't need to add the stress of surprise medical billing on top of that. I urge the board to continue to offer their EPO and HMO plan to state employees. Thank you.
Thank you. Caller with the last four digits, 7003. Please press *6 to unmute, and please slowly state and spell your name for the record. Caller with the last four, 7003. Looks like you've been unmuted. Can you hear us okay? I'll try coming back to you, caller. Caller with the last four digits, 8853. Please press *6 to unmute, and please slowly state and spell your name for the record. Christine Liu, you have permission to speak. Please slowly state and spell your name for the record.
Hello, can you hear me?
You're very faint, but we can hear you.
I can't hear her.
Or can you please speak up?
Yes, my name is Christine Liu, CHRISTINELUU, and I work for the UNLV, for the University of Nevada, Las Vegas. And I would like very much that you do not eliminate the HMO. This program, HMO, has been a partner of all my life, especially in Las Vegas for the last 20 years. The reason why I like HMO is I find is simple and convenient. First of all, the convenient location. There is the a Southwest Medical, a few locations throughout the city, so you can choose it. And when you go to one building, you have all the service, all the doctor in one place. But the second and most important is the billing is very simple. You know exactly, you pay the copay and that's it. I had PPO before, and boy, what was a headache that I have. I always was in the middle. I had to call the doctor office to dispute about the billing. The doctor tell me you have to call your insurance. I call the insurance, they tell me you have to call the doctor, so their billing is never clear. So you never know, you might have a surprise after going to see the doctor. But with HMO, that's it. They know exactly what you have to pay, and you go home and it's done. So I'm asking you if please keep HMO. Thank you.
Thank you. Gina Gamble, please slowly state and spell your name for the record if you wish to make a public comment.
Hi, I'm Gina Gamble, Ginagamble. Good morning, members of the board. I'm representing the University of Nevada, Las Vegas Administrative Faculty Committee. I'm here today to express our strong support for maintaining the HMO as one of the health plan offerings through PEBP. Several members of our faculty and their families, often with children who may need life-saving care, rely on the HMO and suffer from severe and chronic health conditions. The HMO's coordinated and cost-managed structure allows these faculty members and their families to make informed healthcare decisions and plan for necessary care while maintaining financial independence and stability. Without the HMO, these individuals and families may face crippling medical debt, which could otherwise lead to lifelong financial hardship and may encourage those to look for employment elsewhere to keep finances sustainable. The HMO has been a vital resource, enabling consistent and affordable care and ultimately contributing to better health outcomes in our community. While we understand the alternative plans are being rationalized and considered, we urge the board to carefully consider the unique needs of those relying on the HMO. The benefits outweigh the plan costs for individuals, families, and children. Our community is our most important resource and should be invested in. We appreciate the board's dedication to the health of PEBP's constituents. While there might be budgetary reasons to consider this action, we hope you will continue to consider these critical factors as you decide. Thank you.
Thank you. Michael A., you have permission to speak. Please slowly state and spell your name for the record if you wish to make public comments.
Michael Amesquita, MichaelAmesquita. Good morning. I got an email. Oh, my name is Michael Amesquita, and I'm currently working for NSHE through UNLV. I'm a first-generation Latino and graduate with my bachelor's at UNLV. I have always had an HMO since I turned 18. I'm ready to turn 50 next in February. Those, including myself, rely on HMO because we cannot afford 20% of the cost of any accidental illness or accident. I have worked for 4 universities, and I've always had the HMO, and everyone's always said you pay too much, and I don't. I appreciate the premiums, as like others have said, I can go ahead and plan out my financial wellness. When I worked for the George Washington University, I had an HMO, and I came down with diverticulitis. I was operated on and was in the hospital for 5 days. I paid $200 copay of a 40 grand bill. I would still be paying 40 grand bill because no one pays higher ed very well. Tore my ACL and meniscus, was in outpatient surgery, a 16 grand, and it came out to be $100. Wrist surgery for carpal tunnel was $100 because it was outpatient. It wasn't 20%. I could manage these unexpected, and in the case of diverticulitis, I needed that, and I could absorb that into my pay. I pay HMO premiums for these reasons. I have never been close to the deductible, and like what was said before, the last meeting. So getting rid of an HMO would put an unreasonable financial burden on me to my illnesses that I currently have. Currently, my HMO covers 100% without copay my x-rays, as well as all the blood tests that I need for my condition. If I was a PPO, I would not be able to afford this healthcare, and I would most likely have to go to another state. I'm extremely worried about losing my providers. After being back 6 years now, I have finally figured out who are the good doctors for me. If it could just be me, but I feel that Southern Nevada has a larger marginalized community, and taking away the HMO from us, from people of color, marginalized communities, is going to have a bigger negative impact than other parts of the state. And I hope you do not take this away. Thank you.
Thank you. Michaela Lavender, you have permission to speak. Please slowly state and spell your name for the record.
Hello, my name is Michaela Lavender, Makayla, space Lavender. And I am an assistant professor at UNLV, and I'm a health economist. And to voice a alternative opinion from those that have been stated, I think that there should be some consideration of removing the HMO, because I believe the high premiums do not justify the low $0 deductible and the higher out-of-pocket max. I understand the concerns that have been voiced during these public comments, specifically about the networks and doctors that are in the networks and continuity of care. I think if the board is going to remove the HMO, they need to take a careful look at expanding the network of the existing plans and making sure that doctors that people are currently relying on are in those networks. However, as you'll see in my written comments, I do believe that the high deductible health plan is incredibly generous, and there's a lack of education about that option, especially when you consider the $700 HSA contribution that effectively makes the premiums on the high deductible plan $0 plus about a $30 annual contribution to the deductible. In addition, for people who have very high chronic needs, the high deductible health plan does have a lower out-of-pocket maximum. I gave birth to twins last plan year on the high deductible health plan. It was a high risk pregnancy, and the costs were incredibly affordable. And it is not quite as bad as people probably fear, but I feel like we do need to make sure that people are well educated about how to choose health insurance, and we need to consider the network sizes carefully. Thank you.
Thank you. I'm not trying to say this. And Pavliko, you have permission to speak.
Thank you. You said it perfectly. My name is Nicole Pavliko, Nicole, last name Pavliko, Pavlico. I work for Lee Business School at UNLV, and I have been at Lee Business School for 25 years. And for 24 of those 25 years, I have the HMO. For 1 year, I had the PPO, and it was a complete year of uncertainty, never knowing how much I was going to need to pay. And I could never get a cost of care before the services were rendered from doctors' offices. It was always, it depends. So I do want to thank the board for the time to share my concerns today, because I'm extremely concerned about the elimination of the HMO option. It's likely that without the HMO option, I wouldn't be able to afford the health care I receive now. The elimination of that health insurance option would result in a change to my quality of life and very possibly my life expectancy. And this isn't an exaggeration. I have so many chronic health conditions that require me to see numerous specialists frequently, including a cardiologist, a neurologist, a rheumatologist, nephrologist, hematologist, pulmonologist, ophthalmologist, and dermatologist. In addition to my standing visits to these specialists, in the last year, I have had other health issues arise that required CT and PET scans, a breast biopsy, a lung biopsy. If the HMO is eliminated, I expect that my out-of-pocket costs would become prohibitive. That result would be dangerous to my health. I have experience comparing the HMO to the PPO, and I know that the PPO is unaffordable, that 20% is not realistic, and the stress that it adds to not knowing and the uncertainty of not knowing what would cost is also an added burden. Excuse me. In addition, I'm concerned how the elimination of the HMO would affect prescription costs, and I worry that I would need to forgo some of my higher cost prescriptions. Currently, I take a specialty medication to help prolong the life of my kidneys. That medication would cost over $12,000 per month. However, the pharmaceutical manufacturer offers a discount, which leaves me with a cost of over $1,000 per month. Because of the HMO, I don't have to cover that amount through beyond the monthly copay that I have, premium, I should say, I'm sorry. And I'm very grateful for that because otherwise I wouldn't be able to afford this medication. As I mentioned, I did have the PPO for 1 year, but I was not on this expensive medication at that time, so I don't know what those costs would be. I'm revealing a lot to you today about my medical situation, more than I usually reveal to people, because I am very concerned about the potential and drastic change to my health insurance coverage. I also do believe that not having the HMO could very possibly make it cost prohibitive to me to stay at UNLV or in the Nevada system of higher education, to be a public employee. And that could very possibly mean leaving UNLV. So I want to echo some of the concerns for retaining employees if the HMO is eliminated. And we would be losing a lot of years of institutional knowledge and expertise from our Nevada system. And to force those people out and then to force them to find other doctors, I think it's an unnecessary burden when right now we have doctors who will take us and we have coverage that will help support our healthcare. So thank you for your time. And I am really asking, please do not remove this HMO and take away our life-saving coverage. Thank you.
Thank you. We're going to circle back to the 3 callers that are online real fast. Caller with the last 4 digits, 1656. Please press *6 to unmute if you wish to make public comment. Caller with the last 4 digits, 7003. Please press *6 to unmute if you wish to make public comment. Caller with the last 4 digits, 8853. Please press *6 to unmute if you wish to make public comment. And David Kelsey, I'm not sure if you can hear me. You have permission to speak if you wish to make public comment. We cannot hear you. If you had any technical difficulties during the first portion of the public comment, there's another one located at the end of the board meeting on another agenda item. Madam Chair, that concludes public comment.
Okay, thank you. We will close agenda item number 2 and go on to agenda item number 3. PEB board disclosures for applicable board meeting agenda items. Deputy Attorney General Brady Cannell, sorry.
Morning, everyone. Thank you, Chair Grimmer. This is Radhika Cannell, Deputy Attorney General for the record. This agenda item is to allow me to make a disclosure regarding conflicts of interest on behalf of the board members who are eligible for PEB benefits. Pursuant to NRS 281A.420, on behalf of the board members who are eligible for PEB benefits or whose families are eligible for PEB benefits, I offer this disclosure that they will be voting on those items that may affect the benefits available to them or their family members. The law does not require abstention from voting merely because the board member or their family member is eligible for PEB benefits. At this time, I invite any member of the board who has any additional disclosure to make it now. Thank you.
Betsy Strasburg, STRASBURG. I would like to disclose that I'm a member of the Carson Tahoe Patient Experience Partnership Council. It's a voluntary position, and I represent a member of the community. No decisions are made at this council on behalf of CTH. So I will be participating in item number 9 and will be voting on it as needed.
Okay, thank you. Any further disclosures? Okay. Seeing none, we will close agenda item number 3 and move on to agenda item number 4, consent agenda. Consent items will be considered together and acted on in one motion unless an item is removed to be considered separately by the board. Are there any items the board would like to pull?
This is Jennifer McClendon. Can we pull 4.2.2, the budget report?
Any others? Okay, seeing none, I would entertain a motion on all items. And then we will hear agenda item 4.2.2. Do you have a motion on everything but 4.2.2?
This is, oh, sorry. This is Jim Barnes. I so move.
Okay, do I have a second?
Yes, Betsy Strasburg.
Okay. Any further discussion? Those in favor? Any opposed? Oh. So those in favor?
Aye.
Anyone opposed? Okay. Who will be presenting agenda item 4.2.2?
Michelle Whalen, for the record, Chief Financial Officer with Public Employees Benefits Program. Thank you. This is Jennifer McClendon. I just have a quick question about the health and status of our catastrophic reserves. I know that the board voted to use some of the reserve funding to offset the cost of the increase of premiums. So I'm just curious how we're doing.
Michelle Whalen, for the record. Honestly, it is very early in the year. The first quarter doesn't always give us a good picture of projections. It is something that the executive officer and I are monitoring very closely. It's going to depend on trend and experience and what we actually receive in claims moving forward. And that's as straightforward as I can be for you.
That's great. Thank you so much.
Okay, any further discussion? Okay, seeing none, I'll take a motion on agenda item 4.2.2.
I'll move to approve 4.2.2. It's Jennifer McClendon.
Okay, do I have a second?
Jim Barnes, I second.
Okay, all those in favor signify by saying aye.
Aye.
Any opposed? Okay, motion passes. We will close agenda item number 4 and go on to agenda item number 5, Executive Officer Report. Celestina Glover for information and discussion.
Good morning, this is Celestina Glover, Executive Officer for the Public Employees Benefits Program. The report before you just gives you a highlight of what has been going on over the last 4 months and what is coming up. So first thing on the report is the Interim Retirement and Benefits Committee. That meeting will be happening on December 17th. It will be in Las Vegas. Myself and Michelle Whalen will be attending, but we will be attending virtually at the legislature up in Carson City. Essentially, we are going to go over the annual reports for the year, utilization budget report, financial statements, and OPEB. Currently, the financial statements won't be ready, so they may have questions on previous year's financial statements. If they do, we'll be prepared to answer those questions. OPEB will also come out around the same time or shortly thereafter for the current plan year. So that report will not be given. We do have a rollover report that we can submit to IRBC committee, and we will do that if they request it. We had the strategic planning meeting October 1st and 2nd. And in attendance were PEB staff, a couple of the board members, Board Member Weeks and Board Member Kelly, and vendors from UMR, ESI, and Siegel. We had a pretty good discussion about, you know, what is going on in the world of health plans, ideas of where we can take the PEB plan, what benefits we currently are offering, where should we take those benefits, should they be changed, et cetera. We did come to a consensus that new programs and major benefit changes to our plan designs would be looked at for plan year 2027. I know there's been a lot of discussion about the HMO and EPO. Those were not major topics of discussion at the strategic planning meeting. We were looking at wellness programs, diabetes programs, healthcare programs in general. One of the things that did come up is a wellness plan to address more of a global wellness plan to address various health concerns for populations across our membership. And so we will be doing further research on that and releasing an RFP if we determine after all our research that that is the direction we should be going in. And then the biggest thing obviously is we've got legislature starting in February. We will be monitoring for whatever bills may come out of that, primarily because those bills can have a major effect on what we can or cannot do as far as the health benefits. It also will have a major effect on what our budget will look like and what they're willing to fund. So that legislative action may affect plan design, it may affect future programs that we offer, and it will definitely affect employer contributions and employee contributions toward their healthcare. So we will be monitoring that and testifying as appropriate. We will bring the information back on bills to the board meetings and to special one-off meetings if there are any bills that we need immediate action on. Those one-off meetings will be held virtually for the most part because they'll probably be relatively short notice. Enough time to get the agenda posted and then have the meeting and get direction from the board as to what they would like staff to do. PEB did do their budget presentation to the governor's office of finance, and the governor's office themselves were in attendance, as well as representatives from LCB, the Legislative Council Bureau. That was held on September 30th. There were no major issues with our requests. There were a few questions, but at that point in time, it was more informational and no changes were made. Medicare open enrollment, this is just another reminder that Medicare open enrollment is in progress right now. It goes through December 7th. So if you are looking at making a change to your Medicare plans through the exchange, make sure you get in touch with them and get that taken care of. And then finally, the EPO HMO discussion, we had a lot of public comment today. That discussion was supposed to be held today, but we were not able to get the analysis complete in time for this meeting. So we have deferred it to the January meeting, at which time we will be requesting the board to review the analysis and make a decision as to how they would like us to move forward. I will be sending that report out probably next week to the board members. It will not be posted until we get closer to what the agenda will look like and any other reports that we may want to include so that we have a full packet of information for our members. And with that, I'll take any questions.
I have a question. This is Jim Barnes. Could you give us an update on AB 22 and SB 32? Oh, okay. AB 22 is the one that eliminates the board's role in approving a contract, which results from an RFP. And SB 32 makes the quality control officer an at-will employee of the executive officer.
This is Celestina Glover for the record. So those are two BDRs that we submitted. We had a third one, but it was withdrawn as of yesterday. What we are looking at is The QC officer currently reports to the director of the Department of Administration, in this case, Ms. Joy Grimmer, who is our board chair. In the past, that was done to keep a separation of duty. Because of the audit function that the QC officer performed, that position has evolved over time and the functions are not the same. Having the QC officer report to the director of DOA makes it a little bit more difficult when it comes to recruiting and hiring and the reporting structure. So we submitted a BDR requesting that position be moved to PEB, the same as every other executive position. So that in this case, Leslie Biddleston is our QC officer. She would report to me versus reporting to the director of administration. We have found too that sometimes those directors don't realize that that person actually reports to them. So they don't realize how our org is set up. So it just brings that position in. The other one, which with the contracting, what we're trying to do is streamline the process. So right now, we come to the board and say, we want to do an RFP for X, Y, and Z. The board says yes or no. If they say yes, we go forth and take care of the RFP and do what we need to do according to NRS 333. Then we have to have a closed session so we can talk about the results of the RFP, although we have board members that sit on the evaluation committees. And then we have to open the session so that the board can vote on the subsequent contract from those results of those RFPs. What that does is it causes, like we have one right now for the HMO. The evaluation committee was done a few weeks ago. The closed meeting isn't until January. That means we're not going to get to BOE until March. If we had a new vendor in place, anytime we have a new vendor in place that requires a huge amount of implementation action, that late in the game makes it very difficult to get a new vendor on. So we are trying to streamline that process. The board will still have the authority to approve contracts and approve the RFP. They will still be on the evaluation committees. What we're trying to eliminate is that closed session and the delay to get our contracts to Board of Examiners when that's approved. So we're trying to do like every other state agency and follow NRS 333. We're not trying to get out of that. We're just trying to streamline our contracting process and have the authority like any other state agency.
Thank you.
Stacey Weeks for the record. I just want to echo all of that as a state employee and just want to say that I think it's the right thing to do. Better government, streamlining. Our purchasing process is too long, and I think I completely support what you're doing with that bill. And I also very much support the quality control officers actually reporting to PEB. I think that makes complete sense. So thank you.
Any other comments or discussion? Okay, with that, we'll close agenda.
Michelle Kelly here.
Oh, sorry. Go ahead.
Sure. Thank you. I'm wanted to go back to AB 2022. I'm sorry about this. Just something, Executive Officer Glover, you said that the board would still be the approver of the contract. If we're being removed from the process, I don't understand how we would still approve a contract if we're not in the process anymore.
This is Celestina Glover for the record. So what we're looking at is the closed session in the middle to discuss the RFP. What we want to do is streamline our process so that the board will approve us going to RFP in the first place. So it makes sense to me that if you've told us to go out to bid, that you're expecting us to come back with a contract. We can bring that contract back then and say, this is what we've done, this is where we've approved, this is our recommendation, and the board can give their formal approval at that time. But we can shrink that time. Like the RFPs we've got released right now, I could be bringing that to you today as it stands, I will not be bringing that to you till the end of January. So we're trying to close that gap.
So if you could bring it to us today, why haven't you?
Because I have to have a closed session. Sorry, this is Celestina Glover for the record. I have to have a closed session to discuss the RFP itself, the outcome of the evaluation committee, the negotiations, everything that has happened to get the contract in place with the winning vendor. So if I have to do that, I can't bring a contract to you to approve. With the closed session, it also requires purchasing attend either virtually or in person. And that delays us being able to meet our deadlines with the BOE because our board meetings don't necessarily align with the deadlines for the Board of Examiners agenda deadlines.
Okay, thank you. I guess, just a couple of things in response to, I think the quality control officer, I think there was a point in time where it made sense for it to report to administration. I think that was very much a point in time, so I have no objections to that. I guess I struggle with as a board member, what we do if we are no longer involved in anything other than kind of giving permission for an RFP to be released. I kind of see us as we're meant to do plan design, cost control. We're meant to have, some say over the design, and piece by piece, that's kind of being removed. And so, even during, I think maybe 2 years ago, the plan design, we designed a plan that the governor's office or the budget office or someone decided we should have something different. So I'm kind of struggling with exactly as a board member, what I'm doing here every month. And then just from a process standpoint, I don't recall us talking at the board about these BDRs. So I'm not sure if I missed it, but I thought, anything impacting PEB would come to the board first for discussion. So I'm just wondering how these BDRs were filed without them coming to us. But that's all. Thank you.
Ms. Weeks?
Stacey Weeks for the record. I appreciate that, Michelle. I think it'd be helpful for us to have council at some point go over our authority. I don't know necessarily if the board has that kind of authority. So I just want to start with that based on my own read. Second of all, I again think it is process that we're talking about. And I will say it does take a long time. And I appreciate the idea of removing months in the process. And if a board member really feels strongly about being part of the procurement, you can sign up to be on the RFP. Like, I feel like I'm having to do a lot lately sitting on those myself. So if you, Michelle, want to take my place, I would love that because I have a pretty full schedule. But I think board members, we're always being asked to sit on these RFPs, and that is the best way to be involved and engaged in actually scoring these. I don't even think the closed session really allows a board member to be that engaged in the process. So I just would really recommend that board members sign up and agree to sit on those RFP evaluation committees.
And this is Celestina Glover for the record. So when the BDR submittals were done, we were asked by the governor's office to keep our requests confidential until such time as the governor's office released them. So they didn't come to the board per direction from the governor's office. And same as our budget, we could give you a real high level of what our intent is, but we couldn't really provide any detail because it's confidential until such time as GovRec comes out and the governor's office releases that budget. So some things we are held to the same standard as the rest of the state where we can't release that information because our meetings are public. And so we have to tread lightly on what we say or don't say.
Any further comment?
Just the last comment. Thank you for that explanation, Executive Officer Glover. That kind of makes sense with other things. So thank you. And just in response to board member Weeks, I put my hand up for plenty of RFPs. So thank you. For PEB.
Good. Okay. Seeing no further discussion, we will close agenda item number 5 and move on to agenda item number 6. Discussion and acceptance of Claim Technologies Incorporated audit findings for the state of Nevada Public Employees Benefits Program plans administered by UMR for the period of April 1st, 2024 through June 30th, 2024. Joni Amato, Claim Technologies Incorporated, for possible action.
Hi, good morning. For the record, my name is Joni, Joni, Amato, Amato. The scope of the UMR claim audit included all claims, medical and dental, processed during the period of April 1, 2024 through June 30th, 2024. The medical and dental claims paid during the fourth quarter totaled approximately $70.6 million and included approximately 228,000 claims processed. The audit included the following components: a quarterly and annual performance guarantee validation, 100% electronic screening with 50 targeted samples, a statistically valid stratified random sample of 200 claims, data analytics. The fourth quarter audit also included an annual operational review and annual eligibility verification that incorporated eligibility data obtained from TELUS Health. In our auditor's opinion, UMR's financial accuracy, overall accuracy, and claim turnaround time within 14 days decreased this quarter. We did observe an improvement in claim turnaround time within 30 days. The two performance guarantees for claim turnaround time were met in the fourth quarter. The performance guarantees were not met for financial accuracy and overall accuracy. This results in a penalty of 2.5% of the administrative fees for the quarter, or $34,307.68. We recommend reviewing the financial errors identified in the random sample audit to ensure that the root causes have been identified and claim processor training or system corrections are made where appropriate. We also recommend reviewing the results of the electronic screening and targeted sampling to focus on potential recovery and process improvements, mainly in the areas of incorrect provider discounts applied and duplicate payments. We also recommend PEB review the eligibility verification results to determine if improvements can be made in the workflow to reduce payments for ineligible claimants in the future. I'm happy to take any questions.
Thank you. Are there any questions from the board?
Betsy Strasberg, just a suggestion, because the next audit is going to be the last audit of this calendar year. I would like to recommend that we have a page in this audit that shows the summary section over the year, so we can see if there is any trends that is becoming visible, and also areas where definite improvements have been done over the years. Thank you.
Thank you. Any other comments or questions?
Stacey Weeks, I would support that. I think that would be helpful for us in the next report too.
Okay, do I have?
So just, this is Celestina Glover for the record. Just for clarification, the audit just presented was quarter four, so that was the end of plan year 24, June 30th is the end of our year. So what you're gonna see at the next audit is the first audit for the new plan year. So we can look at incorporating those suggestions for the close of plan year 25, which would be, it'd probably be this time next year that you would see that. That will work.
So Betsy Strasberg, again, if that's the case, in the second quarter of the next fiscal year audit, maybe we can have a running page that shows the first and the second quarter. That would be great. Thank you.
Any further discussion?
Can I make one point real quick?
Yes.
I'm not sure if it's helpful or not, but towards the end of the report for UMR, there is a table that shows the performance for each of the financial accuracy, overall accuracy, claim turnaround time at the end for each of the 4 quarters for fiscal year 24. I don't know if that's helpful or if that's what you're looking for. It's one of the very last pages.
Is
of the
that,
report.
sorry, Betsy Strasburg, is that page 24?
Yes.
Yeah. So that's the total. I'd like to see the quarterly trend
So that's by quarter.
by quarter, so I could,
That's on.
oh,
Um,
I see it. Okay, thank you.
is that what you're, I just want, this is
Yeah,
Joni.
that-
for the
So
record,
that
sorry.
gives the metrics and then also the financial amount that they're paying as penalties. If that could be included, that would be wonderful.
Okay, absolutely.
Okay, no further discussion. I would take a motion to approve this item.
Motion to approve item number 6 as presented.
Okay, do I have a second?
Jim Barnes, I second.
Any further discussion? Seeing none, I'll take a call for the vote. All those in favor signify by saying aye.
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 All those opposed? Motion passes. We'll close agenda item number 6 and move on to agenda item number 7. Discussion and acceptance of Claim Technologies Incorporated audit findings for State of Nevada Public Employees Benefit Program plans administered by VIA benefits for the period of July 1st, 2023 through June 30th, 2024. Joni Amado, Claim Technologies Incorporated, for possible action. Please go ahead.
Hi, it's Joni Amato for the record. The scope of the VIA benefits audit included all HRA claims processed during the period of July 1, 2023 through June 30th, 2024. The HRA claims paid during the audit period totaled approximately $19 million and included approximately 192,000 transactions. The VIA benefits HRA audit included an annual operational review and performance guarantee validation, a random sample audit of 200 claims, an eligibility verification, which also included obtaining data from TELUS Health. In our auditor's opinion, VIA benefits showed improved service from the prior audit period and exceeded all of its 2024 performance guarantees, including all self-reported metrics. No penalties are due for the plan year 2024. There were 2 financial errors cited in the random sample audit, one for a duplicate payment and one for payment of an ineligible expense. We recommend reviewing the financial errors identified in the random sample audit to ensure that root cause has been determined, identified, and claim processor training or coaching has taken place. Thank you for your time, and if you have any questions on this audit, I'm happy to answer.
Okay, thank you. Board, are there any questions? Okay. Seeing none. Do you have questions, Celestine? Do we have a motion to approve this item?
Motion. Jim Barnes. Sorry about that. Jim Barnes, I move approval.
Do we have a second?
Second.
Any further discussion? Seeing none, I'll call for the vote. All those in favor signify by saying aye.
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 All opposed? Motion passes. We'll close out agenda item number 7 and move on to agenda item number 8. Health Savings Bank Investment Discussion. Celestina Glover, Executive Officer, Information and Discussion. There is no written report.
This is Celestina Glover for the record. During the last board meeting, I believe it was board member Kelly had asked if we could have HSA come in and do a presentation regarding investments and how the HSA Bank essentially does their processes. And that is what this agenda item is for. And we do have representatives from HSA Bank to answer questions. They'll provide a brief review and then answer any questions the board may have. That I'll turn it over.
Hi, this is Ed Seaver with HSA Bank. Can you hear me okay?
Yes.
Great. So thank you for letting us join the meeting today. Once again, my name is Ed Seaver. I'm a Senior Managing Director here at HSA Bank, reporting into our CEO, Chad Wilkins. I know that there were a couple of questions that were provided in advance of the meeting that I am happy to go through unless the board has any specific questions that they wanted me to answer in advance.
Board members, are there any specific questions before he goes to the written questions? Go ahead.
Okay, great.
Michelle,
so the first question was what? Sorry, go ahead.
I'm sorry. I was trying to find my hand to put it up. Michelle Kelly for the record. My specific question is around the transition to the new investment hub that has kind of started and is going to continue. I'm wondering, I've had a lot of questions, and I have questions myself, but I've also had questions from users of the investment portals, because we were given different information at the customer service level about if we have allocations at Schwab at the moment in investments, they're still allowed to stay there. I think initially we were told that as long as they stay invested, they'll stay there forever. And then when I called most recently, which was a few months ago now, I was told, no, in February, we're going to all be forced out. So I think I would really like to get some clarity around exactly what is happening with I think maybe only the Schwab is remaining for participants out there. And if those monies are being forced across to this new model that has a monthly, a basis point charge on top of investments, then when that's going to occur and how people can opt out of that, if they can opt out. So that's kind of where my specific questions lie. And thank you.
Bender, are you able to answer the questions?
I'm sure it looks like it's still in the call. Looks like he's muted right now.
It looks like we lost him. When I don't think we can hear Ed at this time. So this is Ruth Padroni, HSA Bank. I'm Senior Account Executive for PEB. So Michelle, I'm going to go ahead and just let you know that, Schwab currently right now is at sell only. We're not allowing any more money to transfer into Schwab. But you can still manage the Schwab account. You can still reinvest your dividends and anything you earn off any earnings within the Schwab portfolio that you have. It's just that you can't move any more money from HSA Bank to Schwab. Coming in 2025, you will receive notifications of how you'll be able to go ahead and manage that Schwab account. More likely it is just at a sell status right now. If you have any type of Devenir mutual funds, we are going to be providing step-by-step instructions come in 2025 prior to March of how to either sell those funds or do a transfer in kind. You'll be receiving an email instructions if you have any type of Devenir mutual funds. So we are going to be providing continuing communication as we have been since July of 2024 to our investors, our current investors. So you will be receiving instructions in regards to the Devenir mutual funds. And as it stands right now for Schwab, it is currently, like I said, at a sell only status.
Thank you. Any further questions, board?
It's Michelle Kelly again. I guess what I'm having issues with is that we're all very busy people, and dripping out these instructions without a full timeline is kind of troubling. So is there a full timeline available to participants now who are either in Debinar or Schwab of exactly what's going to happen and when it's going to happen? Because, you know, yes, we're getting communications, but as I say, kind of the dribbling out of information is, you know, it just requires people to keep engaging an issue when some of us are busy in our business life and our personal life and would just like to understand the timeline in its entirety. So is the timeline, including for Schwab, in its entirety already determined? Or is this just something that you guys are working on as you go? Because investments are an important piece of HSAs, right? I mean, the reason we have a high deductible with an HSA is so that people can hopefully save for their future medical costs. And in order to save for your future medical costs, you have to keep up with inflation. And the best way to do that is to invest your money. And so, you know, nobody likes change. And I understand that this is confronting and difficult for, you know, for HSA Bank as well. So I'm sorry. I just, it's just kind of one of those things where I think what I'm hearing from my members and what I personally would appreciate is the full timeline of all activities. And then lovely, keep educating us. But at least if we kind of know exactly what the end game is and when the end is happening, we can mentally prepare for it and start to, you know, do whatever members want to do regarding that situation. So thank you.
Yep, no, I agree totally, Michelle. We do have on our public website, under the members at hsabank.com, we do have an investment transition page, which does provide you, of course, the options for choice, select, and manage, which we're offering now in our new HSA Invest platform. And then we also have FAQs. If you have a Schwab account, we have FAQs for Devenir out there available to you. And that's in this transition page. There is a current timeline, important dates to remember. We don't have a timeline that's going into 2025 at this time, but we continue to update this site for our investors. So this is a very, you know, it's available to you. It's out there at hsabank.com, members investment transition. We also have an investment, HSA investment options page where the information, again, explains your investment options that we're offering now, choice, select, and managed, which, you know, choice is very similar going to be to Schwab. It offers that a large range of stocks, mutual funds, ETFs. The select option, of course, is going to give you that recommended list of mutual funds specific to your, you know, unique risk tolerance and investment objectives. And then the managed is coming in 2020, by the end of 2024, where it provides a higher level of personalization, where IRA actually manages the account and rebalances your investments on your behalf. We have also out on the page, we have, you know, how to invest. It goes step by step, you know, it gives you the steps how to create your, you know, your new investment account through the enrollments. We have an excellent video out there, and then our pricing is also provided out there for our members. So the pricing gives you, you know, for the managed, the choice, and select. It tells you, it gives you examples quarterly, you know, regarding your investment balance. So you can see, like, if you have a $10,000 balance and you're in the select option, you know, how much will that be your annual fee or your choice? So it kind of gives a nice visual too of the fees out there. So we are communicating. We always have this website updated, the pages for our members again. And then, of course, we're communicating through emails and postcards for any members that do not have an email on their account.
Thank you, Ruth. I have reviewed that site several times, and a lot of what I'm asking for is not out there. Otherwise, I wouldn't have been asking for it. So the transition stuff is not out there very well. And as I say, it's not just me, it's other people in, in the South have outreached me. And when they call customer service, they can't get the information either. So I understand that you do have all the new investment stuff and the costs outlined. What I would say is that you're adding costs because Schwab currently we pay management fees. We don't pay administrative fees to you. And now we're going to be paying administrative fees to you when we switch into the new stuff. So that's a significant change because fees are important, regardless of if it's just 10 basis points or, 0.01%, fees are important. But just outlining the full change would be very useful to have out on your FAQs. And with that, I appreciate you coming and actually answering questions.
Sure. Well, I can provide additional information to the board, after this meeting. If you're looking for something totally outlining the HSA Invest platform, I'll be happy to provide that to you if that's what you're looking for. And hopefully, we'll be able to answer some additional questions, maybe in a closed session for you. But, in regards to customer service, I just want to point out that if you have a particular call that you were unsatisfactory with, please reach out to me or or one of the board members, and they'll get that email to me. We can always have that call reviewed. I mean, unfortunately, with 335 representatives, it's hard to provide all the same answers. But the resources and training, we continually strive to educate our customer service representatives with ongoing education and updated resources. But as you well as you know that it's hard on these type of call centers, entry level position turnover. You're going to have more experienced employees than others due to the tenure of the person. So if there's something in particular that you're not happy with in regards to response, be sure to always reach out to me and I'll be able to address that.
Okay, thank you for that. Any further discussion? Okay, we will close agenda item number 8 and move on to agenda item number 9, discussion and possible action regarding Carson Tahoe Health's expressed intent to leave the United Health Network effective May 30th, 2025. Celestine Glover, Executive Officer, for possible action.
Good morning. This is Celestina Glover for the record. So the report in your packet has some options for the board to consider. Obviously, if the board has additional ideas that are not presented in this report, PEB staff will take that and move forward according to your decision. This report essentially discusses the intent of Carson Tahoe not to renew their contract with United Healthcare at the expiration of the current contract. The current contract expires at the end of May of 2025, which is about a month before the end of our plan year. So that is going to be an issue that we'll have to look at. Should this occur, then Carson Tahoe, effectively the facilities and the providers in their organization will no longer be in network. PEB members will be able to access it, but it will be at a higher cost. Emergent and urgent care obviously will be paid as an in-network service regardless of the outcome of this contract. So we've had a number of meetings between the governor's office, myself, and Carson Tahoe, and representatives from UMR and United Healthcare. We've had those meetings as a full group and independently with the vendors so that they can speak their mind without the party being part of the discussion. so that we can get a clear picture. I will say right up front, this is not a PEB dispute. PEB is in the middle of it because we are a big employer in the Carson City area. It affects many of our members who obtain services through Carson Tahoe, and based on public comment and concerns of the governor's office, concerns of PEB staff, we are, trying to help resolve the issue. But we're limited in as to what we can do as an organization. In our discussions with Carson Tahoe, they have provided a couple of options that we could consider. One of those being a direct contract with Carson Tahoe Health. The drawback of that is that we do not internally have the expertise or the staff to actually administer a contract of that type. We know that between the network and the third-party administrator, that there is work done before those claims are paid. That can't happen at PEB. We don't have those people. I wouldn't even know who to assign to it or what they should be directed to do. So that would be a very difficult task for our staff to take on. The other option was to potentially enter into a contract with Nevada Business Group on health. Nevada Health Partners, they're often referred to as the coalition. They have a network and they are willing to allow PEB to join that network. The drawback there is there's additional fees associated with that. Although the fees are not, they're not so high that we couldn't address those. But we don't know what the ultimate cost of the claims will be. Our expectation is that claims costs potentially would increase regardless of the direction that we go, whether it's direct contracting with the coalition, or contracting with another network altogether. Part of the consideration we have to look at is the requirement of NRS 333 and the contracting process. If we enter into any contract, we are required to do a formal solicitation. We've had some discussions with purchasing, nothing in depth at this point, but just some high level, what can we do? What are our options? And really, our options are to go to bid and let the normal solicitation process determine who the network would be. Obviously, we would want to write the RFP in such a way that the Carson Tahoe would be in that network. We don't know where that would ultimately land. But keeping in mind all of these things, should we have to go out to bid, that is likely to result in Carson Tahoe becoming an out-of-network provider for the close of plan year 2025 and the first several months of plan year 2026, depending on how long it takes to get an RFP written, put out on the streets for potential vendors to look at, and receiving bids and evaluation, the whole process. So that is something to keep in mind. We did request that a member from Carson Tahoe be here to answer questions, and they are in the room. And we also have representatives from UMR. So with that, I will turn it over to the board for their discussion and questions.
Okay. Thank you for that. Board members, is there any discussion? Ms. Weeks.
Stacy Weeks for the record. So when we were talking to purchasing, did we ask for a sole source, since they are the only hospital and provider in this area? When there be an exception to procurement or any kind of options around a full-blown procurement? Just wondering if you talked to them at all about those options.
So this is Celestina Glover for the record. They would be a sole source contract if we did a direct contract. That is really not an option for us, simply because we don't have the bandwidth to take that task on. So that would mean potentially getting a second network, and that we could not justify a sole source because there are multiple networks out there. I don't know which networks Carson Tahoe may be on, but we would have to at least explore that option.
Michelle Kelly, I have a question.
Go ahead, Ms. Kelly.
Thank you. Executive Officer Glover, I'm just wondering, you know, I hear you that regardless of the option we take, it's probably going to increase our costs. Just to put some parameters around that, I'm just wondering, obviously a lot of state employees work and live in Carson. Can you, off the top of your head, I'm putting you on the spot, can you say how much of the state employee, maybe state lives, actually use that network? I'm just trying to understand, or what the dollar figure might be that we're talking about as a claims expense. As I say, I apologize for putting you on the record, and I won't hold you to any answer. I'm just, you know, I'm totally don't know.
So this is Celestina Glover for the record. I don't have that information in front of me. I don't know if any of our vendors do. Richard, do you have that information?
In 2022. In 2022 was about 50 million in claims.
Can I get your name, please?
Oh, Richard Ward with Siegel.
Thank you.
Stacy Weeks for the record. On that point, if we're going to be moving folks over to a different group or different network, would those lives be removed from our contract with UMR? And if so, could we not reduce the contract to UMR?
So this is Celestina Glover for the record. No, they would not be removed from the contract with UMR. Same as if we brought in a new network or a secondary network, we would add all the lives to that. The reason being is because we have people that live in Reno, but they're providers in Carson. We have people in Carson, they're providers in Reno. We have people in Vegas that travel to Carson for work. We have people out of state that access providers everywhere. So for ease of administrating those particular contracts, we would include our entire population in both networks. So we would pay fees to both networks if that's where we end up going.
Stacy Weeks for the record. Sorry, one more follow-up on that. So is there anything in the contract with UMR where we can hold, and I don't know who's at fault here, what the issue is that they're arguing about, but part of the reason we contract with UMR is to create a network, and they bid as, you know, agreeing to create this network. And so is there any kind of penalty or anything in that contract for UMR for not making this happen from a network adequacy standpoint?
So this is Celestina Glover for the record.
Sorry.
I think what I would like is for representatives from Carson Tahoe and UMR to come up and answer your specific questions as to how they're addressing these issues and what it would look like for PEB members. Rather than me trying to speak on their behalf. That is why we requested they be here. So with that, I will request that those folks come to the table.
So Nathan Meyer for the record.
I'm sorry, what was the name?
Nathan Meyer.
Thank you.
So your question was, is there anything in the, I don't know offhand if there's what the language in the contract relative to term clauses and network adequacy. I know when we looked at the network adequacy reports that without Carson, there are some specialties that would change in terms of access for the members residing in Carson City. Richard, I don't know if do you have those reports in front of you?
I can speak to them. So you working from a larger access radius and down, and this is Richard Ward with Siegel. Okay, if I answered, okay. PEB's traditional and historic access standard is 50 miles. Using that standard, there would be no impact on access for the removal of Carson Tahoe. UMR reviewed geo access using two tighter standards, 30 miles and 15 miles. At 30 miles, there's still no impact to access. At 15 miles, there's an impact for some specialties, as Nathan was mentioning, which would be for infectious diseases, So these are specialty physicians. Infectious diseases, rheumatology, and for oncology, surgical, and the fourth one is endocrinology. And that's standard, that's based off of access to two within 15 miles. So there's several people that would have access to one. But there's also several that even with the current standards, there's limited access to begin with. So there's just a limited number of providers, period.
Mm-hmm.
One other thing that would be affected is access to hospitals. Roughly 65% of PEB members that live in Carson would not have access to a hospital within 15 miles. The average measurement, though, is 15.3 miles. So if the measurement was 16 miles instead of 15, 100% would have access. But there's some variance there where for people, not everybody lives exactly 15.3 miles from the hospital. And then the other 35-40% do live within 15 miles. So there would be some impact to access. I can't speak to what the terms are in the contract.
So,
There's one more.
yeah, go ahead.
Although I would expect that it would be based off of the 50-mile measurement if there was, because that's PEB's historic standard. But without the contract in front of me, and we weren't under contract when that contract was negotiated, so I don't have institutional knowledge of that. I'll pause now.
Stacy Weeks for the record, thank you for that. I think typically when we're worrying about providers and a plan negotiating, first of all, I'd like to understand what's going on and why we can't come to an agreement. That's my first question. My second question is, we should know as board members, or we should have in front of us what UMR is accountable for in terms of network adequacy. So if it's 50 miles, it sounds like we're fine, but I'd like more information on that, because that is how we hold vendors accountable. That's what we contract for. So that I think is important to our conversation, regardless of the decision we make today. But I would, if you guys are able to tell us what is the issue, I think that would be very helpful for us to understand. Because this is very important to our staff, and it's impacting their ability to get care. And I think it behooves all of us to come to solution on this issue.
Agreed. Melissa Williams, Carson Tahoe Health for the record. Yes, great question. So I'd like to give some context to answer your question and why we're here and this agenda item is up for discussion. Back in October of 2023, over a year ago, we entered into a legal dispute, Carson Tahoe Health, with United Healthcare for underpayment claim and millions of dollars. These claims went back to 2022, so old age claims and a lot of dollars outstanding. After this legal dispute only occurred after many attempts to resolve directly with United Healthcare representatives and without legal action. The final settlement of that dispute, initiated over a year ago, was not received until last month, October of 2024. And these are for claims dating back to 2022. Carson Tahoe Health continues to receive post-payment audits and refund requests for the same issues we were disputing in 2023. Representing underpayment of our contractually binding rates with United. This demonstrates United Healthcare's inability to resolve the root cause of these payment errors and continue to pay us accurately moving forward. And we do believe that United's minimal efforts to repair the contractual relationship with Carson Tahoe Health has left us no choice but to not renew this agreement. And I know it's a very important agreement to this community and to PEB specifically. To ensure our financial viability and continue to serve the community that we do, we have to maintain dependable, reliable relationships with insurance companies, those of which we believe United has failed to provide. Carson Tahoe Health is committed to working with PEB and have identified alternative solutions which have been proposed to you today to keep Nevada State employees within the Carson Tahoe network and without disrupting the healthcare needs of the state workers. So both of the options I do want to disclose, both of the options in front of you have been analyzed by Carson Tahoe Health and represent a savings to PEB in contractual rates according to our analysis. And we will continue to work with Siegel. I know we've we've disclosed some information via an NDA to Siegel to refine the analysis to be more complete, because we do believe that the options in front of you are a savings for PEP.
This is Jean McFarlane with United Healthcare. So I'm not here. I want to first thank the board for allowing us to be here and have a conversation about this. And I'm not here to dispute, sort of get into here, you know, what Carson's representing, what we're representing. What United has continued to say to Carson is that it's our desire to continue to work together to resolve our differences and to move forward in a constructive way in the future. I think those of us that have been around insurance for any length of time, right? There are always differences of opinion, I will call it, relative to contracted providers and the insurance company / the TPA in this case, right? And processing of claims. And I don't think it behooves us to sort of dig into all of that today. I think, you know, what we believe is in the best interest is for us to continue to work together. And Melissa and I continue to have conversations, right? It's not like we're not talking to each other. So, you know, it's our desire to continue to work together with Carson to get to a place where we feel like we're maybe not perfect, but we're in a place where we're moving forward together in a constructive manner, right? That's United Healthcare's desire at this point. And I don't know that it's not Carson's desire, although they've stated, right, that they want to go to termination, but we do continue to have conversations together. So I don't want to represent maybe sort of where they're at, but we will continue. I think we'll continue to talk. I mean, we do still have a relationship together. It's not just PEB members that they see under our contracts today. So we're responsible to other people besides PEB members that we need to continue to work together collectively and address those issues. And that's our intent.
Thank you for that. Any further questions?
Betsy Strasburg, in this document, there are a couple of suggestions that has been put forward by Carson Tahoe Health, but it doesn't say anything about what maybe solutions or proposals that UMR / United Healthcare has presented. Is that confidential, or can you share, what actions have been taken place over the last 6 months to resolve this? The second question I have is that for Carson Tahoe, the settlement is behind you, right? So that is not the issue. The issue is going forward relationships, right?
Carson Tahoe, this is Melissa Williams from Carson Tahoe. So the settlement, to your point, is yes, it's behind us from our initial dispute. One of the points I made earlier is that we continue to see underpayments, refund requests that are the stem of the cause of all of those underpayments. So the root cause hasn't been rectified by UMR in order to pay our claims accurately moving forward, which puts us in a constant fight and struggle to receive payment. So we don't see this improving.
Do you have any?
Yeah, Jean McFarlane with United Healthcare. I mean, I guess I would just, my perspective on this, given your question about sort of what we're doing to present things moving forward to create solutions, is our teams work very closely together. Melissa and I don't necessarily, I think, attend all of those calls, but we're working very closely together with regards to addressing ongoing claims issues. You know, we've set up a cadence between our organizations to address things going forward. I would say, you know, I don't have a percentage available, but my lens into what is outstanding on what we would call working spreadsheets is very small in comparison to the very broad number of claims that we process every day for Carson Tahoe. And is everything perfect? No, I wouldn't say it is. We need to continue to work together with Carson to address, you know, incorrectness. I think it's very difficult for us to sit in this room and say, and try to address individual claims issues and what may or may not be paid against contract, right? That there's those types of things that are going on in processing all the time. So, not only with Carson, but with other systems and other providers, United is working with them proactively all the time to resolve claims that may be paid incorrectly. And sometimes we discover when we're working together that Carson may have thought something was paid incorrectly, and we go through it and they say, yes, you're right, it was paid correctly, and vice versa, right? This is sometimes how the relationship ends up working. But what we have said to Carson and proposed over the last few months is, one, let's make sure that we're working in a way that makes sense for Carson. We determined, how we would exchange claims, who the people that were going to be working on those spreadsheets were, those parties are meeting. We've presented a proposal to Carson relative to modifying the construct of our contractual arrangement, which we believe will assist in less, I guess, disagreement moving forward, because we would change the structure of the agreement as it exists today. So those things are on the table. We just haven't gotten to the point of us potentially looking at them because, we're working through resolution of differences still.
Betsy Strasbourg, I'm confused. Are you saying that you provided a proposal that hasn't been acted upon and no progress have been made? Is that what I'm hearing?
We provided a rate proposal to Carson Tahoe, yes.
Melissa Williams, Carson Tahoe. I can confirm that there was a rate proposal sent to us that basically establishes the same rates we received today from United. I don't believe that proposal in and of itself will resolve the underlying issues that we have experienced and continue to experience in underpayments and payment integrity of our claims. So no, that proposal has not been acted on. Our teams do meet. We meet with every payer, regardless of where we are in the status, and there are disputes with payers. Unfortunately, not really to this level with any other payer. And I guess to answer your question, Carson Tahoe doesn't feel that there has been progress made to resolve these root cause errors.
Yes, Ms. Kelly.
Michelle Kelly for the record. Firstly, I think, what I'm hearing from UMR doesn't seem to truly capture the situation. I have employees, yes, I'm in the South, but I have employees, and when they need to go to the doctor, if they have to drive all the way to Reno, if I was in Carson, we're talking about, instead of just being able to pop out at lunchtime, we're talking about a half-day visit. That's just for routine doctor's appointments, right? So, as an employer, we we need kind of our healthcare providers, especially the primary care providers and the specialists, to be closer, and I think, yes, we have the geographic 50 miles, but I don't think, I think that's more, we usually use that for more rural areas, and I wouldn't consider Carson City to be a rural area for Nevada because it's our capital. So I think, I have great concerns about our participants not being able to access that hospital. Additionally, I think, and I can't even talk to the, to the specialists and providers, but at all of the last meetings, I think for the 6 months that this has been in dispute, we've had, members of the Carson City area come and give testimony during public comments. So this is a big issue. And I just want to put out there that, honestly, I think if we have to, Executive Officer Glover, my personal opinion is if we have to go out to RFP, then I think we go out to RFP. We don't go out to RFP to fill a gap in Carson Tahoe. We give UMR notice that we're going to discontinue their contract, and we go out to RFP for the statewide and the nationwide network. We've had a lot of issues with UMR, which we thought were resolved. The audit report today says, 4 steps forward, and I think it actually the quarter over quarter showed 4 steps forward and 6 steps back. So we've had issues ourselves with them, And now we're hearing that a good portion of our population won't have access in the town that they live. So, you know, I'm just going to put it out there as the bad guy, that, you know, if this dispute cannot be resolved, then we need to go for RFP for the statewide network and the nationwide network, though, because prior to UMR taking the business, we did do an RFP and there were other contenders for the business. Thank you.
Thank you. Ms. Weeks. Stacy Weeks. Michelle, I think actually that's a great conversation we need to have. If we do that, I don't know if that's going to solve the problem, but I do think we need to talk about if we do go back out to bid, what it looks like, improving our network adequacy standards, ensuring that we're able to monitor for these types of issues. If this is really happening to Carson Tahoe and what they're going through, it's an extreme burden, and that's why they're backing out. And I think we need to have better oversight into that, into our third-party administrator. And so if we're going to go out, I really want us to look at how we're going to hold a vendor accountable. And maybe we need to have more than one. I don't know. We need to talk about all of those things, but I just want to make sure that if that's the direction we're going, that we get recommendations on how to do that in a way where we don't end up here again to, you know, in the future. So thank you for that.
So this is Celestina Glover for the record. So I am looking at the contract, and we do have language regarding the network administration, but not specific to network adequacy outside of the 50-mile access limits. So from a contracting standpoint, that would not be the hammer, essentially, if that's the direction the board wants to go. I think going to RFP, obviously we can do that if that's what the board wants to do. I don't know that terminating the contract with UMR is necessarily the answer. But again, we will proceed at whatever direction the board gives us. What we are looking at, you know, what I have said in this would result in 2 networks. One that ideally would include Carson Tahoe. UMR's contract would stay in place until their normal termination, and we would go to bid. And then how would we address that? Because one of the things I did put in my report, the concern is whether it's direct contract or secondary network, is other providers who may or may not have a valid reason to terminate their contracts with UMR may see this as an avenue to go to another network hoping for better terms. And those are things we need to consider as far as, you know, confusion for our members as to who they can go to, when they can go there, what it's going to cost them, all the things we hear all the time. And ultimately what it costs the plan, because if it costs the plan more and it costs the members more, that means the rates go up. Employer contributions can only go so far, and that means it's coming out of the employee's pocket. So all of those things we have to take into account with any decision in any direction we go in.
Thank you for that.
Betsy Strasburg. Carson Tahoe is a community hospital, so it worries me that it's not going to serve a big population of the community. And it's not just PEB members. There are other people who live here and want to have access to a hospital within easy distance. So I'm troubled by that very much. And the Carson Tahoe has recommended this Nevada Business Group on Health and Health Partners question for UMR United Healthcare. I'm sure you do competitive analysis all the time with other such service providers. So apart from not addressing the root causes that Carson Tahoe has indicated, have you looked at what is this provider supplying that maybe you can copy or duplicate or whatever to resolve some of the root cause issues that Carson Tahoe is worried about?
I'm not familiar with, this is Jean McFarlane with United Healthcare. I'm not familiar with the construct of their contracts with Nevada Business Group on Health. I mean, I would comment kind of generally that UMR or any TPA, you know, managed care entity is generally going to have reimbursement and medical policies and other things that are followed with regard to payment of claims. And maybe I'm reading into your comment, Tina, but I mean, I don't know that changing always a contract relationship or a TPA does away with those types of items that may be some of the concern, right, from a provider relative to how claims are processed. Because there's always claims logic rules that apply to things, right, that impact payment, regardless of who's processing the claim, whether it be us or another TPA. I do want to add though, just in response to sort of the conversation around our proposal to Carson Tahoe, the payment methodology that we have provided is different in construct than what we have currently today. And it is United Healthcare's belief that it will support improvement of the relationship relative to some of the items that have been of concern that Carson Tahoe has brought to us. So we do think it will make a difference.
Ms. Kelly.
Michelle Kelly for the record. So I just kind of just wanted to get, I guess, confirmation from the executive officer that UMR is the network in the north for all of our plans, right, including the EPO. So there's no option for employees to switch plans to keep that, you know, Carson Tahoe Hospital.
This is Celestina Glover. For the record, you are correct. UMR is our TPA network for all of our self-funded plans.
Okay.
North, south, and nationwide.
Thank you. And then I have a follow-up because, you know, just reading the kind of the suggested changes, I've kind of heard you say, well, we won't, and rightly so, we won't be able to release an RFP and have a network in place by June 1st. To capture this. And given obviously all of the proposals add significant workload. And then I just heard you kind of say, well, we also have to be careful because we don't want to give other networks the opportunity to see, you know, to say, oh, well, you know, if we take this to the extreme, then PEB's going to reward us essentially. So I'm just wondering, and those are my words, not anyone else's words, so I don't want to offend anyone. I'm just wondering, do you and staff have a preferred option here? I know you didn't want to say.
This is Celestina Glover for the record. I do have a preferred option. I would like UMR, Carson Tahoe to work it out so we can keep providing the services for our members that they need and want. Right now, the way things have been going, between meetings and discussions and research, trying to determine how we can address this issue has increased workload internally. We are relying on our vendors to provide analysis and data every time we come up with an idea. Can we do this? Can we do that? And so far we haven't really settled on an alternative to what is in place currently that wouldn't result in a lot of additional work for staff and confusion for our members. I foresee if we end up, whether we direct contract or have a secondary network, I see a lot of confusion for our members and my call center blowing up because of it. And that is something I would like to avoid as much as we reasonably can. We know that anytime we make a change, there drives a lot of questions. There's a lot of uncertainty right now. You know, we do have members that are trying to determine if there's another provider in town that they can go to, another medical group or whatever it is, there are some alternatives. For providers that aren't necessarily under the Carson Tahoe umbrella. But how many patients can they take on? How many of those patients are currently seeing Carson Tahoe providers? I don't know. And, traveling, they live in Dayton, Gardnerville, or whatever, if it forces them to travel into Reno, we are looking at people that are driving more than 30 miles to potentially get to a hospital, get to a provider. So we are trying to look at all these different areas, but ultimately, as I said, the best course of action for PEB and PEB staff are to have the two parties come to some sort of negotiated agreement that all parties can live with, and that doesn't put PEB members in the middle.
Stacy Weeks for the record. How long has this been going on, the negotiations, and we haven't gotten anywhere?
6 months.
6 months total?
Yeah, this is Melissa Williams, Carson Tahoe Health. The disputes have been going on for over a year and a half. The proposal we received was sometime late summer from United Healthcare, which does change the structure of how we're reimbursed. It doesn't change the amount of how we're reimbursed. I might add, United Healthcare is rolling out a policy on December 1st that will be detrimental to healthcare providers across the United States and further reduce reimbursement. And that's another reason that we don't feel this relationship can move forward.
Last one, Stacy Weeks, for the record, if we were to say that we're committed to going back out to bid, would you guys come to some sort of temporary agreement while we work on and allow staff the time to actually develop some sort of RFP to go back out and see if there is a better option?
Melissa Williams, Carson Tahoe, yes, that has actually been an option we've been discussing with Tina over the past few months.
Okay.
Yes.
Thank you. Any further questions?
Yeah, I was going to suggest that if the date of May can be pushed further to allow both the two parties as well as PEBs to work out a solution that's acceptable for all, because it sounds to me there's either a money issue or a process issue. And coming from a process improvement side of career, I think process issues can be solved. Money issues are harder to solve for both parties. My real concern is that irrespective of what we do, having one provider provide future risks. Are we going to be here another year's time or 2 years' time? Given that Carson Tahoe is a fairly big provider of services in Carson City. So that remains unresolved in my mind.
And Melissa Williams, Carson Tahoe, to your point, I can't predict the future, right? And we've been interacting and maintaining relationships with payers for 75 years. We just celebrated that anniversary this year. This is the first time in my almost 10-year career with Carson Tahoe that we have made a decision like this.
Yes, sorry, Stacy Weeks for the record. How many other payers do you guys contract with that you don't have these issues with? I'm just curious because it feels like to me this is a United issue. Are there other carriers that you work with that you feel are doing this better and you're not constantly fighting over claims?
Yes, Melissa Williams, Carson Tahoe. We're contracted with almost all major payers. If there's a carrier network, we'll become a network, right? So we strive to be in contract with any plan in our community that we serve. And yes, we work with many payers, some better than others. And it's not to say that we don't have disputes with payers, and we have over the years, but we resolve them. And we resolve them without involving the community and the members. And I think that's a difference.
Okay. Anything further?
Miss Woodward raised her hand.
Ms. Woodward?
Yes, thank you, Janelle Woodward for the record. I I'd like a clarification because I feel like maybe I've heard a couple of different things, but is the issue, I guess, first of all, is the issue that UMR is paying you incorrectly, or is the issue that you want more reimbursement than is allowed by our plans?
Melissa Williams, Carson Tahoe, paying us incorrectly is the answer to your question. We're not asking for additional reimbursement, just the reimbursement that we've contractually agreed upon.
So I guess the second question would be that you made a comment about UMR instituting a policy going forward, in the future going forward, that would result in less payment. And I'm not sure how that's possible when they would need to abide by what is allowable in our plans.
Yeah, thank you. Melissa Williams again. It's a great question. The policy, it's risky. You know, there's a lot of members across the United States, providers in general, that are raising red flags about this policy. Essentially what it would do is disqualify certain charges that the federal guidelines allow us to charge to insurance companies or members, and disqualify them from reimbursement. So further discounting what we've already agreed to in a contract.
Thank you very much.
Okay. It's listed for possible action. Do we have a motion?
It's confusing. It's hard to come up with the motion on this.
Michelle Kelly, for the record. It seems like our discussion has kind of veered in the direction that let me say it and then see if anyone wants to structure it as a motion. But it seems like, you know, we want to give direction to UMR to work extremely hard to resolve this issue. This is a big issue to PEB. We need to have it resolved. We also would like Carson Tahoe to start working with UMR to perhaps extend that May deadline, and have PEBP staff start working on on structuring an RFP for that second network, you know, so that we can continue to get services for our employees in Carson City, Dayton, and Gardnerville, and all the other places they live. That's what I'm thinking. I'm thinking kind of that we need three things to be happening simultaneously. We need these discussions to resolve themselves. We need, you know, ideally we would have UMR will come to the table and resolve these claims paying disputes. But in the case that it just isn't going to happen, then I think we do need to start working on an RFP for that second network, since I agree with Executive Officer Glover that we just don't have the staff or the experience or the knowledge to be paying claims directly. And while we do that, we need to, you know, we need some assurance from Carson Tahoe that they'll continue the contract while that occurs if they can't come to terms. Executive Officer Glover, does that sound like appropriate action for today?
This is Celestina Glover. Yes, I think if we can get that into some sort of a motion to essentially go to bid for a second network and to encourage UMR and Carson Tahoe to continue talks, especially with extending the existing contract for a period of time to allow us significant or sufficient time to get an RFP on the streets. We need at least 4 to 6 weeks to write an RFP, start with, and then we need to build in the time that it would be released, the time for analysis of whatever bids come in, and then evaluation committee to meet. And right now, until our bill gets processed, then we're looking at closed session to talk about those negotiations and when can that ultimately get to the Board of Examiners. So we're potentially looking at a contract not going to the Board of Examiners until anywhere between July and December. I can't narrow it down any more than that because it really depends on how long it's going to take to get everything written and out and get the bids analyzed. And then UMR is also our TPA, or third-party administrator. Will that network work with the TPA? That needs to be part of our RFP, so that we don't end up with two TPAs, because that's like, I'm gonna run screaming down the road. So we need to still continue to work with UMR, because we don't want competing issues in that area. Like I said earlier, my preference would be for UMR and Carson Tahoe to work things out. That would be our ideal solution, but we understand that it's a business decision between the two. We are not a party to the talks between them, so I can't give you any more detail than that. I do know that a couple of people did voice their concerns about the future. Going to a second network doesn't mean that we won't have a similar issue between Carson Tahoe and the second network, or some other provider who might be in the second network and that network, because there are policies and procedures within those networks that dictate how they do business. So that can always be a sticking point. And the terms of the agreement between the providers and the networks. If one of the terms is to get reimbursed at a higher dollar amount for claims, even though we're being told that ultimately doing something different saves PEB money, if they're getting paid more for claims, PEB pays the claim. So I don't know how that would save us money. I'm missing something in the middle of there. So that is a consideration that we have to take into account when we do rates for the next go around, and we'll be doing rates prior to that contract coming out. So we don't know if that's going to make a difference. So.
Michelle Kelly, for the record, I'm ready to make a motion then. I'll make that motion. Which is that directing staff to begin preparing a RFP for a second network, seeking to include, that includes the Carson Tahoe network within the broader network. I would also like to add that I like the suggestions from Board Member Weeks regarding putting some guarantees around network adequacy in there that are tighter than what we currently have. So I think if we could do that. Secondly, that while the RFP is ongoing, that we ask Carson Tahoe and UMR to extend their contract through December 31 of 2025, or until we have that second network on board if it's earlier. And then third, is there a third portion of this? So, continue negotiating, because that's the number one piece of this, is that ultimately we would prefer that Carson Tahoe and UMR come to an agreement so that that RFP never needs to be released. I mean, ultimately that's going to be the best outcome here for Nevada participants and for the PEB staff. So that is my motion.
I'm sorry, Brandy Mooneyhan, lead insurance counsel. I got a message from Deputy Attorney General Cannell. I'm not sure if she's having trouble speaking, but she asked that the motion be broken down into two or three separate motions. However, Ms. Kelly would like to break it down, but to break it down into separate motions, please.
Okay. Go ahead.
Okay, so Michelle Kelly here. So I guess the first motion should be that, you know, we direct UMR and Carson Tahoe to continue discussions and negotiations and resolve these billing disputes so that Carson Tahoe remains in the UMR network.
Okay. Do I have a second?
So second.
Any further discussion? Okay, seeing none, I'll take a vote. All those in favor signify by saying aye.
Aye.
Any opposed? Okay, motion carries. Do I have an additional motion?
Michelle Kelly for the record. The second piece of this is that the board directs PEBP staff to begin preparing an RFP for a second network that includes the Carson Tahoe network, and that RFP include tighter network adequacy guarantees and any other enhancements to contracting that would prevent this kind of an issue from becoming our issue in the future.
I make a friendly, Stacy Weeks for the record, just one friendly amendment or comment. I do want to give I want to make sure we don't have any gap for our members and while we're in the middle of this. And I don't know when, I just want some sort of, I think all that should be contingent on the two folks here at the table, Carson Tahoe and United, coming to a temporary agreement until that, you know what I mean? So no one loses coverage. Otherwise, there could be a gap in coverage because there's no incentive now for them to ensure there's not, is my concern. So I don't know how we'd want to word that, but I think we need to have some sort of agreement from them soon in the next 30 days saying to us that they agree that they'll have some sort of agreement. There won't be a gap in coverage while we work on that RFP. Does that sound okay, Michelle?
Yes, that's a great friendly amendment.
Okay, thank you.
Accepted.
Is that structured?
Okay,
for you.
Well, on behalf, Brandy Mooneyhan, lead insurance counsel, just for clarification, and I'm sorry, Member Kelly, if we can clarify your motion now as amended.
Okay, so the motion is that we instruct the PEB staff to go out to begin preparing an RFP for a second network, and at the same time seek guarantees from UMR and Carson Tahoe that they will agree to extend the current contractual provisions while that process occurs. I think that captures everything.
Perfect. Do I have a second?
Jim Barnes, I second that.
Any further discussion? Okay, I'll call for a vote. All those in favor signify by saying aye.
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 Any opposed? Okay, motion carries. Any further discussion on that item?
Betsy Strasburg would strongly encourage that you guys figure out a solution and if need be, engage a facilitator or some third party that can enable you to come to an agreement sooner than later for the benefit of this community.
Thank you. We will now close agenda item number 9 and move on to agenda item number 10. Acceptance of biennial compliance report, Leslie Biddleston, Quality Control Officer, for possible action.
Thank you. Leslie Biddleston, Quality Control Officer for the Public Employees Benefits Program. This report is a report on PEB. It outlines how PEB is in compliance with state and federal requirements for an organization such as PEB that administers a healthcare program. And this report was completed by Siegel, which I will introduce in just a minute. I do want to say that with this type of reports, PEB is always playing catch up with a lot of compliance issues as federal and state requirements do change fairly often. Whereas system changes may have been made, PEB is always playing catch up with plan documents, policies, as we have lots of those out there to make changes to. Lastly, I want to say that PEB staff did review this report with Siegel, and many of the items that Siegel has identified, PEB has already internally identified and has begun working on those things. Without further ado, I would like to introduce Amy Dunn and Olga Walther from Siegel to present the report to you.
Thank you. Good morning. Amy Dunn, AMY-DUNN with Siegel for the record. Thank you for having us. We're thrilled to be here. Nevada Revised Statute 287-04-252B requires an independent biennial review of PEB's program to determine that the program complies with state and federal laws relating to the employee benefits. And our compliance review was based on documentation received from PEB, as well as statutes and regulations that are existing and in effect for PEB for the plan year of July 1st, 2024 through June 30th of 2025. So this report outlines the results of our review and summarizes our findings and recommendations to address certain document compliance issues that we've identified as a result of this review. So with that, I'd like to turn it over to my colleague, Olga Walther, to walk through the details.
Thank you, Olga Walther, Siegel Group for the record. So I'm just going to go over a brief summary of our findings. So as Amy mentioned, the federal and state benefits laws are.
I'm sorry, can you speak up a little?
Yes, I apologize. Can you hear me better?
Yes.
Okay, great. Sorry, I'm soft-spoken. So as Amy mentioned, both state and federal benefits are continually evolving. And so our review mainly noted some areas which PEB should update to enhance its compliance with the federal and state requirements. Those are areas where PEB may already be administering the benefits properly, but the plan documents just need to be updated to reflect that more properly. So on the federal level, the first area that we wanted to highlight were notices, so federal notices. So Siegel reviewed PEB's compliance with federal notices required by the ACA, COBRA, HIPAA, No Surprises Act, and other federal regulations. Our recommendation is to update the marketplace notice, surprise billing notice, and the child support medical order notice. Additionally, we've spoken with PEB about potentially adopting the practice of distributing a new hire packet to better help introduce all the notices and help members figure out where to find those notices when they are first entered into the plan. The second area that we noted were some benefit consistencies between the plan documents. So some of the areas we identified were the pediatric vision benefit schedule of benefits, physician references throughout the document, and the dependent care FSA eligibility definition. We would just recommend that PEB review those definitions and clarify in the plan documents as appropriate. The next area is actually something for PEB to continue monitoring and update. It's not something that is currently out of compliance, but there was a new HIPAA regulation that was passed this year, and the compliance deadline is December 23rd, 2024, with privacy notices that needs to be updated by February 2026. HHS passed a rule that strengthens the protections for PHI related to reproductive health care. And I believe that's an area that PEB is already working on as well. And then finally, on the federal level, as you're all aware, PEB did quite a bit of work on mental health parity in the last year and updated the plan documents accordingly. The final rule was published in September of 2024. And so our recommendation here is to just continue the ongoing compliance efforts. This is an area that's going to be continually evolving as well. We do anticipate more
regulations, more additional guidance that will be forthcoming, and we just recommend closely monitoring that to make sure that PEB remains in compliance. And so then I'll move on to the state findings. So we worked closely with PEB's counsel to ensure we were covering all the statutes that PEB is required to cover under their plan. And the following statutes were identified as areas that PEB should clarify within the plan documents. And so specifically, we thought that the telehealth coverage on the low deductible plan should be covered, clarified as to the out-of-network benefit, HIV and hepatitis C, coverage for testing and treatment of sexually transmitted diseases, substance use and opioid disorder drugs, hormone replacement therapy, and emergency prescription coverage during an emergency or disaster declaration. And again, I would just note here, these areas might already be appropriately covered. They just need potentially some clarification in the plan documents to ensure that the members understand how these are being covered.
Okay, thank you. Anything else? Okay, board members, any questions? No, okay. It is listed for possible action. So do I have a motion to approve?
Motion to approve the biennial report as presented.
Is there a second?
Jim Barnes, I second the motion.
Okay, any further discussion? Okay, all those in favor signify by saying aye.
Aye.
All opposed? Motion passes. We will close out agenda item number 10 and move on to agenda item number 11, public comment period. Public comment will be taken during this agenda item. Comments are limited to 3 minutes per person. Do we have anyone in Carson? Okay, seeing no one, we'll move online.
Madam Chair, we have a few. I'll get the slide up in a moment.
Okay.
Make my As a reminder, joining the Zoom meeting as an attendee is for making public comment only. If you do not wish to make a public comment, please leave the meeting so you're not accidentally called upon. And please watch it on the PEB YouTube live stream on the PEB YouTube channel. The link to the live stream is also located on the agenda. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced and you have been advised you have been unmuted. Please fully state and spell your name for the record and then proceed with your comments. Debbie, you have permission to speak.
Can you hear me?
Oh, yes, we can.
Perfect. Good morning again, board members. Again, my name is Debbie Arteaga, DEBBIE-ARTEAGA, and I am chair of the Faculty Senate at UNLV. During this public comment, I will speak again against the elimination of the HMO, and I will also address the conversion of the low deductible PPO to a standard PPO. I'll begin with financial impact. Forcing patients onto the PPO will be a tremendous financial strain for many of our colleagues. They are living paycheck to paycheck and cannot afford a deductible or an unknown copay. Inflation and increased housing prices mean that many colleagues already face financial hardships. Interest rates have also skyrocketed. In the words of one colleague, I am paying 50% of my income in rent. I will have to forego medical care if the board eliminates the HMO. The HMO option also contributes to healthcare equity. For example, the HMO helps protect employees with children, single parents, and those in marginalized groups. Colleagues have told me that the HMO option allows them to plan for healthcare costs, as opposed to the PPO model in which they will be expected to pay 20% of costs that are unknown. There are less obvious costs associated with the elimination of the HMO. Colleagues with the HMO are able to access healthcare in all one building. So they can get their tests done, blood drawn, anything that they need to get, x-rays. That means the employees have to take less time off for appointments and tests. Now I'll address the low deductible PPO. The low deductible PPO will be transferred to a quote, standard PPO, end quote. Colleagues believe that this new PPO will be more expensive in terms of deductible and copay. It is impossible to know for sure what lies in store for those on the low deductible PPO because no financial information has been released. Again, we touch upon the financial impact. Colleagues on this plan cannot afford to pay a higher deductible. The increased contribution for the HSA, as I understand it, will only apply to those on the consumer-driven healthcare plan. There are two other issues that concern my colleagues. One is the fact that the partner in marital unions will not be able to receive health care until the summer. I also want to echo a point that was made this morning. Retired colleagues have pointed out that their monthly stipend of $260 a month does not cover the premium supplement of $388 per month. Thank you.
Thank you.
Thank you. With a caller with the last four digits 1393, please press *6 to unmute. And please slowly state and spell your name for the record.
Hi, my name is Jared Keller. That's Jared, last name Keller, Keller. I'm a faculty member with the Nevada System of Higher Education and a PEBP member. I want to make the board aware that the concerns shared by Carson Tahoe representatives about UMR and United Healthcare at today's meeting may be more systemic than the board may be aware. Carson Tahoe is opting to walk away from the relationship with UMR and United Healthcare. Other healthcare providers remain within the network, but are resorting to shifting responsibility for claims payments directly to the members themselves because they are experiencing significant challenges seeking payment from UMR and United Healthcare. I've recently experienced significant challenges finding an optometry provider. I contacted 4 local optometrists, including my long-term provider, and received a similar message. All indicated that they were either no longer accepting the insurance or that I would be required to pay the full cost of services up front, then seek reimbursement on my own through UMR. When I inquired about this, they all shared the same story. They're not being paid on time or accurately by UMR. Others shared that UMR is quick to deny payments from providers erroneously. They also shared that inaccuracy and instability in provider payments is economically unsustainable for their practices and administratively burdensome for the medical providers. I think this is clearly supported by Carson Tahoe's decision. Because of this, providers are resorting to shifting the burden of claim payment to PEBP members. Paying for the full cost of in-network covered healthcare costs upfront is absolutely unacceptable burden to place on PEBP members. I encourage the board to evaluate continuance of PEBP's relationship with UMR, United Healthcare, and hold UMR and United Healthcare accountable for expeditious and accurate provider payments. Thank you.
Thank you.
Thank you. Caller with the last 4 digits 1656, please press *6 to unmute. And please slowly state and spell your name if you wish to make public comment. David Kelsey, you have permission to speak. Please slowly state and spell your name for the record if you wish to make public comment. Madam Chair, that is all that concludes public comment.
Okay, thank you. Seeing no other public comment in Carson or online, we'll close public comment agenda item number 11, and we will adjourn. Thank you for everyone's time.